Welcome to All Things Africa, the podcast. Listen in as Levy, Mike, and Linda discuss socio-political and economic current events and how they affect Africans worldwide. On this episode of All Things Africa, we want to know what are some cultural considerations in the battle against COVID-19 in Africa. Africa's coronavirus cases have surged to more than 336,000, an increase of nearly 10,000 infections from Wednesday, June 14th. That's according to the Africa Centers for Disease Control and Prevention. The jump is largely due to South Africa announcing its largest daily number of new cases, 5,688. The CDC Africa chief says the pandemic of the 54-nation continent is picking up speed very quickly, while shortages of testing materials and medical equipment remain severe in many countries. More than 4 million tests for the virus have been conducted on the continent of 1.3 billion people, far short of the ideal. Let's start our conversation today. So today we are talking about the cultural considerations when battling COVID-19 in Africa. Most of the governments are working to limit the spread of the virus by asking citizens to frequently wash their hands with running water and soap, use hand sanitizers, stop shaking hands, staying at home, using face masks when they're in public places, avoiding touching their own faces, mouth and nose especially, maintaining a distance of at least 1 meter or 6 feet from the next person, avoiding overcrowded places or gatherings, such as places of worship or open air markets, and adopting proper hygiene, like sneezing and coughing methods to lower the spread of infection. Of all of these preventative measures, 3 are very difficult to enforce in Africa. At least 3 of them are very difficult to enforce in Africa: the social distancing, hand washing, and definitely staying home, right? So let's talk more about that. Like how do you think these measures, the ones that I just listed, are gonna be really implemented in Africa, or are they, or what are ways or unique ways that they could do it?
Well, I could say just taking on the one you pointed out, the social distancing, which is the most common one that we know about. I think from the way families are structured, where you have intergenerational sort of families living in one house, you don't have that luxury or that ease of social distancing within a household, because in a household, even in bedrooms or living rooms, people share those spaces. And so even in that case, then you don't get that 6 foot spacing. But I guess it's also, when I think about my own experiences in places like markets and places like those that are structured in a way that does not allow for that distancing to happen, perhaps because of the way shops are set up or the way walking spaces are set up, that space is very difficult also to control in such a way that you have that social distancing happening in that space. So, and you could almost go to other places where things are done communally, where people gather in very small spaces. And these are also just structural limitations that make it hard to achieve that kind of social distancing, especially if you have to do it constantly and do it all the time. But I think it's also an issue of the costs that come with social distancing and the consequences that everybody tries to avoid when it comes to social distancing. And those will make it hard to actually do social distancing effectively.
Yeah, I think it speaks to a larger, just like you said, I think it speaks to a larger question that, or observation that, in Western countries, it is easier for somebody to have independence, to reach a certain level of independence in their life without really interacting with many people. And that's culturally, first of all, not how many African societies are set up. There's that cultural almost flavor to us that involves interactions. which has then been built into how, just like you're saying, our neighborhoods, our households are formed. So by design, just implementing social distancing still requires you to, go into a place that involves a lot of interaction with a certain group of people, whether that's neighbors or your family. There are certain interactions that just have to happen for life to keep going. People have to go to the local shop, the kiosk, to get something. That has to happen. There might not be enough, whether it's fridge space or even consistent electricity to store your groceries in the freezer. So you have to go out and interact. So I think just part of the fabric of the society in terms of our daily lives, our daily bread, is so intertwined with interactions that it's just hard to actually implement something that requires a significant reduction in that.
Yeah.
Or even if you are, if there is a choice that people can make, they would rather default. It's hard for people to choose, well, do I compromise my daily bread or do I, volunteer to be compliant with this government advice? And when people are making marginal decisions about their daily bread, they're more likely to say, I have to continue seeking the means for my survival, so I'm going to go and interact and hope for the best.
Yeah, and as a woman, I'm thinking of a woman's perspective, in Africa, especially if you're not wealthy enough to have electricity and water and, say, a refrigerator in your home to be able to store food for long periods of time without it spoiling or without having to, create more problems for your family. I think about the fact that most of the people that are in those marketplaces are women, especially those, whether they're purchasing or they're selling items, a large majority of them are women. And so with women, a lot of them also, if they have young children, they have to bring those children with them. There's no one to care for them because they don't have the means to afford someone to care for them, or might not have a relative that lives with them that can care for those children while they go do that. So oftentimes they're taking their children with them. And so they're putting themselves at risk. And I feel like this is an issue that, highlights more systemic issues that previously we could get away with not addressing, for other diseases or other public health concerns. But when a pandemic like this happens, it shocks, these countries to the core because you're so unprepared, you're grossly unprepared. And we haven't set up marketplaces with enough space between vendors. Even if you did employ social distancing of the people, of the customers, let's say, right? Because here in America, when we go to a supermarket, yes, they have social distancing set up. So we're 6 feet apart as we go into the store. They limit the number of people that go into the store. Is that even feasible in the marketplace? You would have to almost segregate the vendors, have them come in on separate days to sell their goods and services. They'd have to be spread out themselves. And then the people would have to be somehow directed to go into the marketplace. And we know how the marketplace is. There is no regulation at all. Everybody comes and goes and stays as long as they want to, meet people up as long as they want to. So trying to regulate a place like the marketplace, it's definitely going to become a hotspot. And to me, unfortunately, it's going to yield a larger number of women being infected more than men, and then they're able to carry it back home with their family because they spend a lot of time also in the home, caring for people and things like that. So it's interesting because it sounds easy from a public health standpoint, from the CDC or World Health Organization, to create these standards, but when it comes to implementing them, it's a whole nother beast, right? And oftentimes, if it's too hard, we know our governments are not going to do it in Africa. They're not going to push for it. They're just going to hope and pray that nobody gets, that the issue doesn't become too large in those places.
But I think it also, you're right, and I think the governments get. If I was in a position of leadership in a government, to me, part of what this is telling me is that there are limits to government influence, and I wouldn't want the public to become more aware of that, because then if it starts to be more obvious that we can talk about, we can put an advisory out there, people will just not be compliant, and then what other areas can that play out?
Yeah.
So I can see them making a decision to just say, you know what, this is not either that, or if they force it, the economic consequences, they might feel like they don't have the tools to mitigate those.
Yeah.
So, it becomes, in that cost-benefit analysis, that what you think you have in your wheelhouse to mitigate any potential negative economic effects. Yeah. You might which would then threaten your position as a government, right? If you, on the other side of this, you never know what it stirs up.
If you go back to the lessons that we've learned from other pandemics, which some of the points that you touched on and Linda is touching on, when you think about the period of HIV and Ebola, one thing that was established was that communities play a vital role in preventing and responding to pandemics. And in that case, then there is a role for communities to play then, in the sense that it doesn't have to be top-down solutions, but community-based responses can also have a major difference in the sense that communities have more knowledge of how they are structured. Communities have more knowledge of what creates crowding, and communities can also just come together to talk about how do you sort of restructure the community interactions, which is a point Mike made. And I like that phrase, fabric of society. Because if you think about the fabric of society from the idea of interactions and networks, you have these dense networks that are already patterns that exist, and they exist for a reason. Even if you bring the idea of social capital, they exist for this reason of well-being, for thriving, for livelihoods. And within communities, you could find these responses that are built within those communities and developed in those communities. And this was what happened. Even in the case of Ebola, what happened was that community interventions were able to uncover beliefs and stigmas that perpetuated the spread of Ebola. And so there was an attempt to effectively communicate at that level of community on how to deal with those issues, the beliefs around economic issues, beliefs around health, belief around interactions, and so forth. So there could be something to be said about community-based responses as well here, in the sense that it's not always looking at the government in terms of how does the government expect or would like communities to respond with regard to these measures that have to be taken.
I agree. I like the idea that allowing the communities to come up with solutions from grassroots level. I think each community knows their unique set of circumstances. It is important to still have community health workers that go out and explain what's going on, in terms of they can understand, and helping people understand how the virus spreads and how they could properly mitigate those concerns. It is going to be definitely up to the community, because I think what we see worldwide is the access to testing is very hard, right, to get. So most people can't count on being tested to really know the proper numbers in their community. They need to be able to properly know the symptoms, so that if somebody's feeling ill, even though they can't get a test to confirm it, there's things that they can be aware of, and maybe even take steps to make sure that that person gets the care that they need early on. For a lot of our communities, that might mean consulting individuals in our family that might have funds for something, but instead of waiting till somebody can't breathe, if you've noticed the signs that they've been coughing, they've had a fever, they've had stomach problems, they've had all these things, then you know that within a few weeks or just a few days, it could turn bad. So seek help early on, right? Versus just waiting until the right time. And a lot of times care means going miles and miles outside of where you live in order to get proper care. And like I was saying, this pandemic has really highlighted government's inability to handle major needs of the community, because whether it's America or Europe or Australia, they all struggle with how to properly deal with this. And so I can imagine nations in Africa who have a little bit less resources and less time and less skill to be able to handle something like this. It's harder. It's even harder for those. And gratefully, we are a little spread out. I think a lot of the villages are not getting as large of a spread when it comes to coronavirus as the major cities are, right? And I think first thing that a lot of major governments can do is absolutely close off travel to the cities, to the village, because if we can keep the people in the village from getting infected, we could lower the need for our hospitals being overcrowded or the ability to be able to care for the people properly. And then we can focus on the cities, trying to come up with some strategies that will lower infection in the city. But as far as the village is concerned, they still need to take those strategies and those procedures to protect themselves, whether it's social distancing or trying to wash their hands, down to even water access. Most countries, very few people have plumbing or water access. Most people have to gather together somewhere at a well or a pump to get water. And so coming up with safe procedures of how to go get water is important. As simple as it may sound, but that makes all the difference for the number of people getting infected.
And that does require sort of. Go ahead, Mike.
Yeah, go ahead.
No, I was going to say that, you're talking about this idea of, what you're pointing out is this idea of community spread, right? So in the idea that there has been a case made that most countries are now at that level of community spread, where initially the cases were that these cases were increasing because of visitors that were coming in. That was back when the cases were few. But now that the cases are going up, the claim is that these are community spread cases. And that's when you start realizing there's risk that needs to be controlled. So you have this difference between an isolated outbreak within a community, which could occur, and you also have a national catastrophe. And within communities, if you have a community-based response, you could also take into consideration those beliefs. And the Ebola situation really taught us a lot in terms of countries that learned from it, was that beliefs and stigmas, and you and I, we were all at some point talking about these beliefs that were playing a key part, simple, key beliefs in burials and how burials should occur. Because when you read a lot of these cases, you find that there's a lot of emotional investment in burials and things like that. And other norms also come to play a role. So the idea that you could actually stimulate communities to think about those beliefs and norms and influences within communities that could play a part in preventing that outbreak at a national level. I remember, this is not related to coronavirus, but I remember a case recently where I was reading about priests as influencers, Catholic priests and other priests from churches that were involved in a campaign to end I think it was something about domestic abuse, that they were being, no, it was about controlling child growth or child population. And they brought priests and they brought community leaders who now were sort of told that you play a key part in influencing the beliefs and norms in these communities. Maybe we should bring you into a campaign to also talk to people in the community. And it did play a big role. So within communities, there's other kinds of responses that can be brought up to deal with these cultural challenges that we are talking about.
Yeah, and you talk about churches, but also when we have funerals in our communities, that's a huge gathering event sometimes. And I know that there's been a few cases in some countries where there's a funeral, a lot of people attend, and then as a result of that, we see numbers climb, or at least even if they're not able to test them, you'll see that a large number of people are sick, and it's clearly the symptoms of coronavirus, even if they're not able to confirm them. And it's because people can't resist gathering, for cultural reasons. It's as if it is basically our cultural practices are more important to us than the possibility of contracting this illness and passing it on, and a large number of the people that gather there are the elderly. We're not talking about just the young people that attend these funerals and carry on these traditions. They are middle age and older because they've had these practices for so long. It's disrespectful not to show up and mourn and grieve. And so how do we mitigate those? We don't have the luxury of using, say, Facebook Messenger or Zoom, and all those things to create some kind of memorial. So these people are going to gather. So coming up with measures that they can still gather and maybe not be so close together, have them, because I still see videos of, memorials where everybody's still sitting next to each other. There's literally no changes, right? It's like, spread out the chairs. If you're going to have a memorial, fine, spread out the chairs. Find a way if you can get a microphone, even if it's just the one that, the handheld speaker system or something. That way everyone can still hear, everybody can still come and mourn, but they don't need to be together in one space, and do it outside so that at least the sun can, and being outdoors, you don't have the virals going into the air and others consuming it. It's easier if you're outside in an open space to do that, even in the city, find a big open space to do it instead if you must follow those cultural traditions.
But asking people, if you're right, and I feel like asking people to do that, since we already know they're not going to do it, if you are not putting some kind of incentive for them to be compliant. And you can't be at every funeral, so so you can't have a physical presence to ensure compliance. So really now it comes down to how you're able to message and how you're able to convince people to voluntarily be compliant. And I think that takes so much trust and relationship building, beforehand, before you're able to really achieve that level of voluntary compliance and sort of responsibility when it comes to things like that, because it's just impossible to have somebody, some kind of government official around. Because you're right, people are too passionate and it's just too personal to them, and something they feel they have a responsibility to do that. If you can't force them, it's just not possible to force them into it. Plus, it'd be too much to even so inappropriate to do that.
Yeah, I like that
it just shows me how much of a lack of trust and relationship governments have with communities.
That's a very good point, and I think it goes back then, back to sort of thinking about what kind of relationships exist between whether it's local or regional or national government and citizens, and whether citizens are willing to listen, depending on that relationship. And adding to what Mike is saying, which is a very good point, it's not just trust and relationship building, it's also understanding and empathy. Because as Linda points out, if you have an older population that has been committed to a certain worldview or committed to beliefs and norms and values, those are not things that change in an instant. Those are things that have been developed for a long, long time, and lives are built around them. And you don't just come in and say, okay, now those beliefs don't count and that worldview is irrational, and so switch. There was actually a critique that the response to coronavirus so far has focused too much on epidemiologists and the scientific community, but there has been little involvement with community and civil society and NGOs. And so what happens is that then you have, which is important, you have science, which has to be respected, because science, and you've seen this in the case even in the US, where you see the head of infectious diseases in conflict with the president, because yes, you have science, but then you also have other people who have a different worldview, and the only way you sort of break that barrier is talk, and bring those to the table as opposed to assuming them. And so I think the point here was that, okay, it's not to say that those are more important than science. But the point is, how do you sort of find a way in which those two perspectives can be taken into consideration in the messaging, as Mike is pointing out? Because then if you push it too much from an epidemiologist and science and policy standpoint and ignore the values and beliefs, which in times of uncertainty, what people do is they use beliefs and values to decide what to do, because it's so uncertain. So you fall back to your beliefs and values and your worldviews that may be in conflict with science, but they don't have to be. And this is what the cases with Ebola actually taught people, was that you needed to talk to communities on how to message. You needed to talk to influencers on how to message. You needed to build a relationship. You needed to build interactive radio programs that play a vital role in sort of building this conversation, so that people feel that their worldviews and what they believe in is also respected. And we've even seen this in the recent cases where, churches say we need to open, God will take care of this, and you have to respect that. You can't sort of say, oh, no, this is science, you have to stay, because people will still try to find a way to live out their lives in that way. So I like that point about trust, relationship building, understanding, empathy, and talking about how can different perspectives, different worldviews, different values and beliefs, and all these things work with science and epidemiology in shaping policies and norms and rules on how things can be done.
I think you make a very important point about empathy. And I thought about this a lot when it comes to, some of the rhetoric that's been discussed of like, oh, just open it. We can't risk like the economy crashing. And so if a few older people die, they die, and it's interesting because that screams the lack of empathy, right? If we were in a different situation, we would want somebody to think about how we would feel about those words, but more importantly, those actions. Many places have reopened and they don't care who's getting infected, and we're leaving it in the hands of those individuals to kind of protect themselves. And while if you're of a higher socioeconomic status, or you have some funds, you can keep yourself a little bit more at home and protect yourself. The elderly, say in places like America, Europe, or wealthier countries in Africa, they definitely are able to keep themselves at home, hire somebody who's going to go do the shopping for them, don't have actual physical contact with those people. But when you think about the elderly in, poorer communities, they don't get the choice of isolating themselves, So if you think about that mom that has to go to the marketplace and sell goods to be able to make funds to buy food for her family, she comes back home and she might have her elderly mother or father living with them. She can't limit contact with them, right? And they can't limit their contact with their daughter either. And so you're dealing with empathy here. And I think this might be a place where Africans and communities and different levels of the community can kind of talk about, listen, we all have respect for our elders. Let's make sure we have them for longer than beyond 2020, because at this point, the decisions that we make that seem so much more important because of financial reasons or other things, we're not taking into consideration the possibility of losing our elders, because they're the ones who are most affected by this virus. Ebola affected everyone. So I think it was easier to get everybody to pay attention, get together and work on this. But when it comes to a community, if you're not part of that community, that small minority here in this situation, the small minority is the older people. If you're not part of that community, you see the behaviors that everyone's continuing on. I mean, yes, it's important to have food. Yes, it's important to have funds, but would it be okay for us to lose our elderly? What impact would that make in our communities? What history and what traditions would we lose because of them? I can confess, as somebody that's in her 30s, I am not as deeply rooted with my cultural traditions as my mother was and as her mother was before her, and each generation we're kind of losing a little bit more. So the more that we lose these elderly individuals, we're losing our culture and our traditions and our practices. Some, yes, we could afford to lose because they might hinder us from moving forward. But other things, are very important to who we are as Africans and as specific, tribes or countries and cultures. And so I think about empathy as being a good starting point, because while all those other things are important, we can probably find a way around it. If it means that we collectively go, all right, let's pitch in together. If you're a family unit, let's say, all right, maybe we move all the elderly people to this person's house and we take care of them there, and we move over here, and you adjust until the time being, and be able to provide them food or whatever the case is. I think about Rwanda in this aspect. When the virus first started, I think they were the first ones talking about they would take, and I don't know how long they've carried on this practice, but it was wonderful to see in the beginning, they would take water. I think it was either the military or the social services. They would take water and food to every poor home in hopes to keep them from going out and increasing the infection rates. And so their early infections rates were largely from the foreign population or healthcare workers or those individuals that work for NGOs. But what they did is they try to mitigate dealing with the poor first, because the poor was the ones who are going to continue to use public transportation. They're still going to go to the marketplace. They have to do all those things just to make a living. So if you give them what they need, food and water, then they won't need to go out, right? And if schools close, then you don't have to worry about paying for school fees. And so some communities, it does take a top down and a bottom up approach to really quickly mitigate and lower the number of rates overall. And I find that really important, because I wonder if Rwanda, because of its experience in the past, and the situations they've been, were they very sensitive to the needs of the community, much easier than other places. A lot of places have not gone to the place of reunifying a country. And so that requires a lot of grassroots approach and empathy and sympathy and proper policies and procedures. And so they were able to kind of take charge of their communities and their needs a lot faster, I think, because of their experiences. And I'm hoping that a lot of governments in Africa take the time to really look at, okay, this is why it's important to do more than just loot your country or do whatever you feel is best because you want to stay president or whatever. But it's more important to be able to care for those individuals, because what are you going to lead if you don't have people?
Yeah, I think
and
it goes back. Go ahead, Mike.
That speaks to, I was just going to say that speaks to some interesting things. When you were talking, I was thinking about how this really reflects on that line, like you were saying, between what is appropriate without taking into account the cultural implications. And, those as different, this is not going to be the last challenge that, say African countries will have to face. Like there are different challenges that are coming up. The world is changing, and the questions between, what do the solutions look like within the cultural sensitivities of the country or the community. In other words, there might be some solutions that will have to look different from with an African country versus a European country. And we'll have to be able to understand both the implications of both. We need to understand what the implication of the Swedish model would be for Sweden, given that kind of cultural and demographic profile, versus ours, and how that would affect us. Our identity, our culture, and all those things. And that ranges in all kinds of changes in different parts of our everyday lives, whether that's here we're talking about it at the intersection of culture and public health, or public health practices. But it could be at the intersection of culture and technology, culture and privacy, culture and climate change. It could be so many different things where we have to be more sensitive and kind of have look at the bigger picture in one sense, but also be able to look at the context within the bigger picture is applied and apply the nuances that are necessary to not just have better outcomes, but also preserve the parts of our identity and our cultures that are the most important to us.
I like that point. I think that's a much bigger picture point to think about. What can we learn from this challenge?
Right.
From trying out different solutions and learning from them immediately. And I guess it's also being intentional about learning and being intentional about recording those lessons we learn from this particular challenge, because challenges will always come, especially those that, create these situations of unknown unknowns where you don't know what to do about them. But even in a case in point, South Africa, according to certain experts, is that they were able to sort of take the lessons that they learned from the HIV epidemic and see how to move forward. And one of the things they learned is that you need to engage various stakeholders in the battle against HIV, and they've repeated learning from that. I like that point because it means that we can think in terms of how do we also just create relationships between government, communities, local government. Going back to the point, Mike, you made about trust and relationships. I read a case this weekend in Kenya. I don't know if you know this organization called Shofco. It's an organization that does work in the slums in Kenya, in the two major slums in Kenya. And the leader of that organization is apparently in one of the government committees that's dealing with the COVID situation. And he was saying that as someone who is on both sides, where he sits in this committee on government, and on the other side he's worked in Kibera and Mathare, which are two big slums, when he goes back to their communities and works with them, what he finds is that people don't trust the government enough to actually go with what the government wants them to do. And he's also echoing that same message. We need to learn how to trust each other. We need to learn how to work together from top and bottom. Yeah, but because this is not, like Mike says, not the last challenge. But from this challenge, we can learn a lot.
I agree. And I hope that most of these governments and these countries learn the importance of infrastructure, having proper plumbing, proper irrigation, proper, electricity for people, a good economy where people can find work, well-paying work that they can either save money for times like this, or those companies are able to support their income for a period of time if need be. And the lack of all of these things is leading to the large number of cases. And, while the numbers may not seem that large in Africa, people have to remember that they're probably not testing as much as they are in other places, and when you don't test, you can't confirm for sure whether people have COVID or not. But if we notice the number of people dying in communities, I don't know about your communities, but we've had a high number of people dying in our communities back home. And we know that it's related to people gathering. And after that, there's been a bunch of cases of people being sick and whatnot. And those that are capable of getting tests are tested and found positive. But others, they don't know whether they're positive or not, but we see them getting sicker and sicker by the minute. And so we know that there's no other sicknesses going around. So it's gotta be COVID in these situations. But I think of the number of cases that could be mitigated if people have access to water in their homes, have electricity in their homes, if they had employment opportunities that allow them to have a larger income so that they can save a portion of their money for times like these, because it's only those situations that are allowing people to be able to remain home and to be more socially distanced and lower their chances of spreading or catching the virus, And so hopefully our governments are paying attention to the importance of these things, because it's more than just money at the time. It's future concerns that come up, that if you don't lay that proper infrastructure now, it makes it very difficult in times of a pandemic or any epidemic, that you won't be able to properly win the hearts of the people. Because if you were properly providing services all along, there wouldn't be this distrust between government and the people. If you've been providing our needs, then when the time comes, I trust that you'll be able to continue providing our needs through a pandemic. Join us for the next episode of All Things Africa with Levy, Mike, and Linda. To get instant notifications on new episodes, subscribe to our podcast wherever you listen to our podcast, or find us on Anchor at anchor.fm/allthingsafrica. Follow us on Twitter and keep the conversation going with the hashtag AllThingsAfrica.